Hi there, this is Lindsay Lopez from Southeastern Physical Therapy. I'm joined today by Dr. Jeffrey Carlson from Orthopaedic and Spine Center. Dr. Carlson, how are you?
I'm doing very well. Thanks for having me. I appreciate you inviting me so we can talk a bit. Thank you very much.
Yeah, absolutely. Thanks for joining us. So I'd like to talk with you a little bit about spine surgery. Can you just tell us a little bit about some of the conditions that might require spine surgery and how you go about diagnosing these conditions?
Yes, that's a very good question because there are a lot of misconceptions related to spine surgery. A lot of people think, well, back pain is something that's going to end up needing a spine surgery. And actually, back pain is not one of the things that lead to spine surgery. So we think more about pinching of nerve roots, which begs the other issue about another question is patients come in and say, I feel this pinching kind of thing in my back. Well, pinching, pain related to pinching is not pinching of the nerve. So the pinching of the nerve pain is actually pinching going down the leg. So you feel this shooting pain down a leg, shooting pain down an arm, and each nerve has a specific distribution. So I think about the hand, with C5 goes to the thumb, C6 to the two fingers here, 7 down to the side of the hand and the small finger. So each nerve has a specific pattern. So we can almost guess that as we're talking to the patient about what kind of problems they're having, which nerve is being compressed, and where we need to focus our attention. So yeah, when we think about patients that need back surgery, it's mainly nerve-related surgery. So surgeries to relieve nerve pain more commonly than back pain. So back pain is generally going to get treated with physical therapy. And so ways to help mitigate back pain versus having a surgical option for back pain. So we think about that differently as surgeons, whether or not we're thinking about back pain versus nerve pain. So nerve pain is one of those things that leads towards surgery, and back pain generally not.
Okay. So if you get a patient in and they get a diagnosis and it's something that you feel like does require surgery, what can a patient expect kind of leading up to that procedure?
Well, there's a couple things that we're going to do. First, we're going to take and examine the patient, see what's going on with them, make sure our hunch is correct. Is it from our physical exam and from the history we've gotten from the patient, and we're expecting a specific nerve pattern, a specific injury, a specific problem with diagnosis, we want to make sure that we have that correct. So we're going to go through the x-ray studies, we're going to go through their physical examination as well as their MRI scans or CAT scans, anything like that that gives us that information, and we put that together. Patients lots of times will come in thinking, well, the first thing I need is an MRI scan to help with the diagnosis. Well, the first thing you need is a physical examination. Let's take a look at you, go through the history, see if the history matches the physical exam, and then we can decide, is this something that needs further imaging, MRI scans or CAT scans, that sort of thing. X-ray studies are done pretty much on everybody because the X-rays really give us a handle about the positioning of the spine. So an MRI scan without an X-ray, not all that helpful, but putting the two together, an X-ray and an MRI scan, can be very, very beneficial for working on that diagnosis. So after we get to that point where we know which diagnosis we have, we know which nerve is being pinched, where the instability is, what problems we're having in the spine, then we can discuss what options we have. And in general, there's three. It's either medications, that's pills or shots, therapy programs, exercise programs, work on stability, work on core strengthening, keeping the bones from shifting and moving so it doesn't irritate or pinch the nerve root, help stop the back pain or the neck pain for that matter. And the last, of course, is surgical options. If you've got things that are leading towards surgery, and what I mean by that is neurogenic compression that leads to weakness, changes in neurologic symptoms, so numbness, weakness, pain. Weakness is the big one, because the weakness tells us that a nerve root's really being compressed and not functioning well. So thinking like a water hose. So if you're pinching a water hose and that the water can't get down through the hose, you've got to unpinch that hose in order for the water to move. We're thinking about the same thing with the nerve. If the nerve is being pinched, the information can't get down that nerve and make the muscle function. So we've got to unpinch that nerve in order to allow the muscle to function again. So that's when we're thinking about surgical options. So we'll go over all the surgical options that are related to that. There are simple things that we call discectomies, just removing pieces of disc, or fusions where we're putting in screws or rods, or disc replacements where we're putting in something that's mobile, something that actually physically like a disc. in order to take the pressure off the nerve root. But the whole reason to do the surgery is to decompress the nerve and take the pressure off the nerve root. So after we go through all those options, really very important to understand that with patients is whether or not they understand what the expectations are. We're going to take the pressure off the nerve root and help you recover, help that nerve pain to go away, help that muscle function to recover, and an expectation of timing. Muscle pain and weakness generally will take several months to go away. Numbness can be 6 months or a year for it to go away. But understanding that waking up from surgery is generally not a magic wand and everything's gone back to normal again. So understanding those expectations between the surgeon and the patient. Then we'll go through all the things that we need to do with getting them ready for surgery. So lab work, especially now, right? Lab work with the COVID testing. So we're going to do a COVID test. So the patient's going to get a test. They're going to have the swab put in the back of their throat or in their nose, and they're going to test to make sure they don't have the coronavirus. In doing that, we've also got to be quarantined for 7 days. So after you have the test, you get quarantined for 7 days and make sure that you don't have the virus and you're not around people that may have the virus. So we don't want the virus getting to the hospital or infecting other people or healthcare workers for that matter. And then all the lab work and all the studies of preoperative anesthesia and everything that needs to be done in order to get to that point where it actually gets you to the operating room.
Okay. Okay. Wow. Yeah, that's quite the process, and it sounds like COVID has added an extra layer to all of that pre-op stuff. Following the surgery, what does the typical recovery look like, and how important is physical therapy in that recovery?
Yeah, so there's a couple things there. So it depends on the type of surgery, of course. So if we're talking about disc surgery, so we call it microdiscectomy, or removing a piece of the disc. That's kind of the smallest spine surgery I do, removing a piece of the disc to decompress the nerve root. And generally it works extremely well to fix that problem. We don't want that disc to re-rupture. So if the disc is ruptured through the back of we call the annulus, the covering of the disc, there's a little hole that's there. We want that hole to seal over, and that may take about 6 weeks for that to seal over. So there is some risk in that first 6 weeks after a microdiscectomy or small disc surgery of that disc re-rupturing. So we don't want them lifting more than 20 pounds. We want them being active and walking, but no real strenuous activities, bending forward, leaning forward, putting weight on the disc. We really want to keep away from that to allow that to heal over, and that takes about 6 weeks. Different than doing what we call fusion surgery. So if you're taking out the disc in the neck, say we're going to take out the disc and we want to put in a piece of bone graft and a plate there, that's nice and stable. So we're not worried about that disc slipping and moving or having it re-rupture. Those patients can get back to their activities very, very quickly. Similar, even quicker than that would be what we call disc replacement. So specifically in the neck, we're going to take out the disc and take the pressure off the nerve root and fix that nerve pain. The typical has been putting in a bone graft and plate fusion, we call it. Now we're able to put in something that's mobile. We think about a knee replacement or hip replacement. You take out the knee or the hip. You don't want that stiff. You want it to move like a knee or a hip would move normally. And now we've got a replacement for the cervical spine, the cervical disc, to have it move exactly like a normal, healthy cervical disc. So that's really incredible, because now you can have that disc, get your nerve pain, get your arm to function again, no pain, and in 2 weeks you're back to work again, back to everything normal, because we're not waiting on something to fuse or heal. It's already stable, and we've got something there we want to move anyway. Rather than fusion, where we're trying to keep it still, let it heal, let the bone fuse across there and let it to heal. Where this disc replacement now allows it to move, so we're able to get patients up and moving quite well. Had lots of patients, especially people that are trying to get back to work now. I mean, obviously the COVID has really knocked people out, but if you have a disc herniation, you can't work, we want to get that fixed and get back to work as soon as possible. So we've got several firefighters and construction workers, guys that said, listen, I just got to get fixed, get back to work. I've been off for 3 months. What do I do? Let's get you fixed, get it replaced. That way you can get back to work within 2 weeks. So it's been a big change in how we think about surgeries.
Yeah, that's very interesting. I had no idea that you were doing disc replacements. That's really neat.
Well, the big thing in spine surgery now is outpatient surgery, right? We've been doing it for years now, but kind of building up to this. But this has really been helpful in this type of environment, especially with the coronavirus. People don't want to be in the hospital. makes a lot of sense. I mean, people are sick in the hospital. Our patients generally are not sick. They've got a problem, they got pain, they've got some dysfunction, but they're not sick. So those patients, we get them fixed. So even in lumbar spinal fusion, so we're putting in screws and rods, taking out a disc, those patients go home the same day. So you're up and walking that same day. You're able to eat your own food at home. You don't have to get hospital food. Get your own food at home. Sleep in your own bed, your own environment. You can pet your dog, all those sorts of things that give you comfort at home rather than being stuck in the hospital where there's other risks of being hospitalized. So most of our surgeries now are going to outpatient surgery. So you're in the hospital just a couple hours, get your surgery done, and you go home. We have a physical therapist and a nurse to come to the house. Physical therapist gets you up, get you moving, make sure you're safe getting up and getting around. Don't want you falling down and breaking a hip after you've had back surgery, but we want to make sure you're safe. And no, it's not a good thing. not a good look for this patient or the surgeon for that matter. But getting up and getting moving, getting back, because motion is life, as we say, right? Want patients up and moving. The reason why we did your surgery is to get you up and get you moving. So you've been down long enough. Let's get you fixed and back to life.
Great, great. So where's your clinic located? Where do you see patients?
So we're in Newport News, an area called Port Warwick, right in the center on Jefferson Avenue. So that center there, we've got our offices there where we see patients. Our pain management center is there. So if we're talking about doing epidural injections, that's all there. The X-rays, of course, are all in the office here as well. We have our own MRI scan as well. So the MRI scan is done right here at the office. We also have our surgery center. The surgery center is opening up here as of October 1st. So again, another step away from the hospital environment. During the COVID crisis that we've had this past few months, the hospital had to shut down. They were taking care of patients that had COVID. So in order to mitigate some of that, we're able to move those patients to a surgery center where they're not taking care of the coronavirus patients. They're taking care of patients that actually need surgery. And it's a bit frustrating for patients that are in pain from their back or their neck, and they've got a pinched nerve, and they're in significant pain. But the hospital then telling them, well, you can't have surgery because it's not life-threatening. But for these folks, it's severely limiting in what they want to do. It may not be threatening to kill them, but it is something that's really severely put them down. So they can't live their life because of this pinched nerve. So we want to get that fixed and get them back. So we can do that as an outpatient setting in the surgery center and back to life more quickly.
Okay, great. So when should a patient schedule to come see you, and how can they schedule an appointment with you at your office?
Well, there's several ways. If you go to our website, www.osc-ortho.com, you'll find our website there, and that has all the ways of getting in touch with us, and you can book your appointments online. We can book those appointments also virtually. So like we're doing now with this meeting today, we can talk online. You can show me your wound. You can see how things are healing, and then talk about what the next steps are. Go over MRI scans and X-rays, those sorts of things virtually, as well as coming into the office. We're COVID-free here, and we've got all the PPE and all the distancing that we need in order to make sure patients are being safe, being taken care of here. So we want patients to feel like they're being well taken care of. But yeah, so you can go to the website and see all the ways to get in touch with us so we can get you in and get you managed, get you taken care of.
Wonderful. Well, thank you so much for your time today. I really appreciate it.
Oh, thank you, Lindsay. It's been a wonderful pleasure.